Walk in, I'm just gonna wash my hands, put on gloves, provide privacy. Hello, my name is Justina, I'm a nurse. Can you please state your first and last name for me?
Brenda Rodriguez.
Okay, and your date of birth?
May 15.
Okay, perfect. Do you have any allergies?
No allergies.
What about any pain? Are you in any pain?
No pain.
No pain? Okay, I'm just gonna ask you a few questions. Do you know where you are?
I'm in the hospital.
Okay, and do you know why you're here?
I check up.
Okay, and do you know what day of the week it is?
It's May 20.
Okay, perfect.
Tuesday.
Tuesday, okay, perfect. All right. Okay, well, I'm just going to be doing a head-to-toe assessment on you. Your vital signs and your visual acuity, which we used as a Snellen chart to test cranial nerve 2, was done prior to the assessment. Both looked awesome. Your vision came back as 20/20, which is good. So now, before I start, I just wanted to ask you, how are you feeling lately?
I'm feeling good.
Good, so your mood has been okay?
Yes.
Okay.
Good.
Good. All right, well, I'm just going to start, if it's okay, I'm just going to start palpating your head, looking for any bumps, scars, or lesions. None are noted. Hair is evenly distributed. Skull is symmetrical. I'm just going to look at your face. Your skin is normal for ethnicity. Now I'm just going to get this pen light and just look into your ears. That's okay. All right, so I'm just going to pull it up and back. Okay, tympanic membrane is pearly, shiny, gray, and translucent. No drainage on the left side. Now I'm going to do it on the right. Tympanic membrane is pearly, shiny, gray, and translucent on the right, no drainage, and ears are symmetrical. Okay, now I'm just going to shine this pen light into your eyes. If you could just look straight behind me at the wall. Okay, pupils are equally round and reactive to light. Now I'm going to assess accommodation and the 6 cardinal fields of gaze, which is cranial nerves 3, 4, and 6. Just follow my pen light with just your eyes, not moving your head. Okay, and accommodation and the 6 cardinal fields of gaze are intact, which is good. Okay, so now I'm just going to have you just lean back for me just a minute. I'm just going to check your nose. Okay, no deviation, no drainage, nose is symmetrical. Now I'm going to assess cranial nerve 1, which is olfactory. Can you close one nostril in your eyes for me? Tell me what you smell.
Finger.
Okay, other side?
Finger.
Okay, perfect. Cranial nerve 1 is intact. Okay, can you just open your mouth and say ah for me? Tongue presser. Okay, gag reflex is present. Can you swallow for me? Okay, perfect. Are you able to stick your tongue out? Okay, move it side to side. Okay, cheek to cheek. Okay, cranial nerves 9, 10, and 12 are intact, which is good. All right, can you just swallow one more time for me? Okay, trachea is midline. Neck has no bumps, scars, or lesions. Now, if you could stand up for me real quick, I'm just going to assess your thyroid. Okay, can you swallow one more time for me? Okay, thyroid is non-palpable, which is good. You could just sit back down. Okay, so now I'm just going to touch your face, and every time I do so, if you could just say touch.
Touch, 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 touch.
Okay, good. And then can you open and close your jaw for me? Okay, so TMJ is smooth and no clicking. Okay, are you able to raise your eyebrows? Okay, can you close your eyes? Try to open them with me pressing on them. All right, can you smile for me? Clench your teeth. Okay, perfect. Cranial nerves 5 and 7 are intact. Now I'm just going to assess your lymph nodes. So I got preauricular, postauricular, occipital, retropharyngeal, submandibular, submental, anterior cervical chain, posterior cervical chain, and then can you just raise your shoulders for me? Supraclavicular, and all lymph nodes are non-palpable, which is good. Okay, so now I'm just going to have you turn your head to the side, to the left for me. I'm just going to assess for any JVD. No JVD on the right. Other side, to the left. No JVD on the left, which is good. Okay, now I'm just going to auscultate your carotid arteries and assess for any bruits using the bell of my stethoscope. No bruits are noted. Now can I just have you lean forward for me? I'm just gonna palpate the one and auscultate the apical. No pulse deficit is noted, which is good. Okay, now I'm just gonna palpate, make sure that they're equal bilaterally, and they are, they're 2+ bilaterally, which is good. Okay, so now are you able to go like this for me as fast as you can? Okay, good. Upper cerebellar movements are intact. I'm just gonna have you stand up one more time for me. Now I'm going to be assessing cranial nerves 8, which is the whisper and Romberg test. Are you able to close one ear for me on that side? I'm going to whisper a phrase.
I don't know.
Okay, perfect. Other side?
I don't know.
Okay, perfect. All right, now I'm just going to have you just stand still with your eyes closed. I'm just going to assess for Romberg for 20 seconds. Look for any swaying. Okay, perfect. Negative Romberg test, which is good. Are you able to walk a few steps for me there and back? Okay, patient has no impairments with gait and balance, which is good. All right, and you can just sit back down for me. All right, now I'm just gonna look at your chest. Patient is uncomfortable exposing their skin and their chest, so that's why they're gonna have their shirt on. But I'm just looking at the chest though, and there's no edema, no bumps, scars, or lesions. Skin is normal for ethnicity. Sternum is midline. Patient has unlabored breathing, which is good, and kind of respiratory rate as I just did it, and it's 18 breaths per minute, which is normal. I'm just gonna look at the arms. Same thing, skin is normal for ethnicity, no bumps, scars, or lesions. Skin is clean, dry, and intact. Now I'm just gonna assess your radial pulse. 2+ bilaterally, brachial is 2+ bilaterally, which is good. Are you able to squeeze my 2 fingers for me? Okay, able to push up against my hands? Okay, down. All right, patient has good strength bilaterally, which is good. Able to move your arms down. Patient has good range of motion. All right, now I'm just gonna assess capillary refill. Less than 3 seconds bilaterally, which is good. Now I'm going to assess the deep tendon reflexes. So I got brachioradialis, 2+ normal brisk response bilaterally. Now I'm gonna do the biceps. 2+ normal brisk response bilaterally. Now I'm just gonna do the triceps. 2+ bilaterally, which is good. Okay, and now I'm just gonna assess for skin turgor. Less than 2 seconds, which is good. So you're pretty well hydrated, which is good. Okay, are you able to breathe in and out for me? Okay, patient has even respiratory expansions, no alterations in configuration. Thoracic cage is symmetrical. All right, so now I'm just going to assess your heart sounds. So I got aorta valve, second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. And I got the mitral, fifth intercostal space, left midclavicular line. And now I'm going to assess the apical pulse for 1 full minute. Apical pulse is 80 beats per minute, which is normal. All right, so now I'm just gonna do your anterior lung sounds. Just breathe normally for me. I'm just gonna do the laterals. Okay, I got normal lung sounds in all fields anteriorly. Now I'm just gonna do the back side. Let's move your hair out of the way. Okay, I'm just gonna do the lateral. Okay, let's go to the other side. Okay, and I got normal lung sounds in all fields laterally as well, which is good. Okay, so now I'm just gonna have you lay down for me. Okay, and are you able to move this foot to this knee, heel to shin? Okay, and other side? Good, all right, so lower cerebellar movements are intact. Okay, so now I was looking at the abdomen, but before I do so, are you able to tell me when was your last bowel movement?
It was today in the morning.
Okay, and was it normal?
Yes, normal.
It was, okay, and then when did you last urinate?
Today in the morning.
Okay, and what was the color of your urine?
Light yellow.
Light yellow? Okay, did you have any pain or burning while urinating?
No pain.
No pain? Good, good. All right, so now I'm just gonna look at the contour of your abdomen. It's rounded. There's no evidence of ascites, no distension, which is good. So now I'm just gonna auscultate your bowel sounds. And this would be stethoscope to skin. So I got right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. And I got normal bowel sounds in all quadrants. Now I'm just gonna flip it to my bell and I'm gonna assess the abdominal arteries. So I got aorta, left renal, right iliac, left iliac. And I got no evidence of bruits as I listened, so that's good. All right, so now I'm just gonna percuss. I'm just gonna go like this. Just see if I can hear tympani. And I'm able to hear tympani in all quadrants, which is good. So now I'm just gonna lightly palpate. Can you just tell me, do you have any pain or tenderness?
No pain.
No pain? Okay, what about here?
No pain.
No pain? Okay, perfect, that is great. All right, so now I'm just gonna have you just sit back up for me if you can. Okay, all right, so now I'm just gonna look at the legs here. The skin is normal for ethnicity, no bumps, scars, or lesions, no edema. I'm just gonna assess for skin temperature. Okay, and skin temperature is warm bilaterally, which is good. Now I'm gonna do the dorsalis pedal pulse, 2+ bilaterally, posterior tibialis, 2+ bilaterally. Are you able to raise your feet up against my hands? Down, okay, good. So patient has good strength bilaterally, which is good. Now I'm going to assess the deep tendon reflex in your knee. Okay. Okay, good. All right, good. So I got a 2+ normal brisk response bilaterally, which is good. All right, so now I'm just gonna assess capillary refill. Less than 3 seconds bilaterally, which is good. Okay, are you able to just move your legs for me, just like this for me? Good, good. So patient has good range of motion, which is good. Okay, so now I'm just gonna just check my notes just to make sure I didn't miss anything before I finish here. Okay, perfect. And I'm just going to assess cranial nerve 11 real quick. Are you able to go like this for me? Ear to shoulder, side to side. Okay, able to raise your hands up against my shoulders? Okay, good. So cranial nerve 11 is intact. All right, well, I'm just going to document my findings to the provider, and the doctor will be in shortly to speak with you. Thank you for letting me do my head-to-toe assessment on you. Thank you so much.